Welcome back, viewer. Today we have an amazing topic. We're talking about breast cancer. And I have an amazing guest in the studio with me. We're going to pick from where we left. We're talking about, is there any hope after diagnosis, after the presentation, then you go to your doctor, then you're told you have cancer. Let's find out. Is there any hope? Remember to hit our social media handles, GBS TV Africa. Our SMS line is 21144 for questions and even comments. Welcome back, Mike.
Thank you.
No, you're talking about hope.
Yes.
Because outside there, it's as if it's a death sentence. So is there hope?
There's hope. There's hope because there are different modalities of treatments. So there's hope.
There's hope.
Yes.
So you're talking about different treatment modalities. I believe treatment forms.
Yes.
Now, kindly tell our viewer which type of treatment modalities or forms do we have towards this cancer?
Thank you, Ben.
And are they available in the country?
All these modalities I'm going to mention, they're available in the country. And treatment depends on the stage that you're coming with. We have surgery, it's a treatment modality. We have chemotherapy, it's a treatment modality. We have radiation therapy, which is a treatment modality. And we also have the newest on board called hormonal therapy, which is a treatment modality that we are using currently.
Okay.
And all of them are available in the country.
All of them are available?
Yes.
So not need somebody to panic and maybe begin to raise fundraising to go to India, Europe?
We have qualified, trained personnel in the country to offer all these treatments.
Thank you for the clarification.
Yes.
Now, let's demystify them one by one.
Yes.
Surgery. Is it that all cases are done surgery? Let's talk about surgery. In breast cancer.
Yes, not all cases are done surgery. When you come in early stages, 0, 1, and 2, surgeries can be of benefit.
Okay.
And we have different types of surgeries. We have a lumpectomy, which is called lumpectomy. We just remove the lump. We have simple mastectomy, which we remove just the breast without the lymph nodes. Then we have the radical mastectomy. We remove everything plus the lymph nodes. And then we have the last one, which is called reconstructive mastectomy, which is we mimic the breast so that the patient does not feel less of a person without a breast. Okay. So that's reconstructive surgery. We try and mimic and put something that looks like a breast.
So that the body image.
Yes, to improve the body image. And
so it's more of a cosmetic?
Yes.
For cosmetic purpose?
For confidence and cosmetic purpose of the patient.
Wow.
Yes.
So they construct something that looks like a breast?
A breast. Yes.
Oh.
Yeah.
Because you find out most patients after the surgery, there's that stigma, they fear even walking in public.
Yes.
Because the society will talk about maybe they don't have one breast or both breasts. So there's that fear.
There's that fear.
So they should not worry. There's reconstruction.
Where the medicine has taken us right now, we should not worry about what people say in the society, because after that, your clinical oncology will advise you.
Okay.
After this surgery, we can do this, we can do this. So you should not fear that people talk about, oh, I have only one breast, or I'm disabled, or I'm what. For the confidence and for cosmetic purpose, we also do reconstructive surgery for our breasts.
Okay.
Yes.
Now, you talked about the early stages.
Yes.
And you talked about surgery can cure it.
It's curable, depending
on the first stage. Surgery can be very efficient.
Very curable in the first early stages.
So if somebody comes in stage 4, do you recommend the surgery? Because maybe somebody can come to your facility because they have heard there is something called surgery for breast cancer. So they insist. So I'm trying to look at somebody in stage 4 at diagnosis. Is surgery recommended?
Surgery, yes and no at the same time. Because for this patient in stage 4, most likely this cancer has already metastasized. Imesambaa kwingine.
So it has moved from the point of origin?
From the point of origin to other part of the body.
Okay.
So you can't go ahead and dissect every part where the cancer cell is. So it will be a challenge. But why did I say yes? Because probably it could have interfered with the normal functioning of your body, or there's interference, there's pain. So probably you can also try just debulk, try to kupunguza
the bulkiness, if the tumor is huge.
It's huge. So tunaweza fanya surgery.
Okay.
So that's why I said yes or no.
Okay.
Yeah, stage 4 is a challenge because already this cancer has metastasized to other part of the body, and now surgery is no longer an option here. What we could think of is another modality of treatment which can help.
Okay.
Yes.
That brings us to that point, other forms of modality.
Yes.
You talked about surgery. Now let's talk about chemotherapy. To our viewer there, what is outside watching us, in a simple language, what is chemotherapy? And is it, because I believe maybe some they believe it's a machine that you go in, then you receive some drugs, then you go home. So what is chemotherapy?
Chemotherapy is this is a chemical treatment that is used to treat tumor, cancer cells, and is given by a trained personnel in a hospital setup.
Okay.
So there are different types of chemotherapy for different types of cancers. And if you talk of chemotherapy, you're talking of drugs. We are using drugs, systemic drugs. And this is the modality when the surgery is probably not working. This is where the option we have. Because it's used by destroying the cancer cells, try to starve the cancer and destroy them and kill them.
Okay.
So there are forms of chemotherapy depending on which type of cancer you have, and also depending on the stage of your tumor. If assuming probably you had surgery and the cancer cells, few of them remained, you also prescribe chemotherapy just to destroy those cancer cells that remained. Assuming probably we came with a big tumor and it's not possible to do surgery, we try and give chemotherapy to try and shrink the tumor, and now it will be easier for the surgeon to go and remove the tumor. So chemotherapy is used in different perspectives. It can be used before surgery and also after surgery.
Okay.
Before surgery is basically to reduce the tumor size, and then you go in, they dissect the tumor, and then after surgery is that probably when the surgeon was in, there's some cells, few cells that remained. So we give chemotherapy to destroy all these other cancer cells that remained.
Okay.
Yes.
So after surgery, just basically to the small ones which were spared.
Yes, spared.
Surgery.
Exactly. Yes.
Okay.
Or rather, there was spillage during surgery, so there's some cells that remained.
How is it given, the chemotherapy, in a hospital setup, so that somebody maybe was diagnosed with the cancer of the breast the other day, so maybe they are fearing, what is this chemotherapy? Because I was told by my oncologist, you're going to start chemotherapy next week.
Yes.
So that they can understand, how is it given, this chemotherapy in a hospital setup? Because you say it's supposed to be given in a hospital setup,
yes,
by a qualified person,
yes,
who are specialized in cancer.
Yes. How is it given? There are different modalities of giving chemotherapy. We have chemotherapy that we take orally. We have chemotherapy that we inject, and then the chemotherapy that we give via vein.
The vein.
Yes. So chemotherapy is basically a scheduled treatment. You come in, they do your blood works, you see if your liver is functioning well, your kidneys function well, the body count cells are okay, they're functional, and then they give you a vein, they hydrate, and then just connect the chemo, the trans. Depending on the drug, there's those that run for 1 hour, there's run for 2 hours, there's run for 3 hours. So there are those chemotherapy we give via orally, there are those chemotherapy we inject, and those chemotherapy we give via vein. There are different veins that we give. We can give either as a peripheral vein. These are the veins we put in the hands and legs. We can also have things like central lines. These are veins we fix in the jugular sites, and then there are those ones we put on the called chemopod. We insert in subclavian veins. And then you go that port, when you come in for the hospital, they put an extension, then they connect the chemo and run through it. Then when you're leaving, they check the extension, and then the chemo goes. So those are the modalities that we get chemo.
Okay.
Yes.
You talked about scheduling. So is it a one-day thing, or it runs over a certain duration period of time?
Chemotherapy is it's a journey. It's not a one-day thing. Depending on the type of cancer you have, there are those that you can do 2 weekly. The dose we can do 3 weekly. The dose we can do monthly. Yeah. So it depends with what type of cancer you have. So it's not a one-day thing. It's a scheduled treatment whereby you can have 6 cycles, 12 cycles, 8 cycles. So it varies with the type of cancer you have.
Okay.
So it's not a one-day thing treatment.
Thank you.
Yeah.
Okay. Now, it's a form of treatment.
It's a form of treatment.
And
Yes.
All treatments, they have side effects.
True.
So in chemotherapy, which are some of the, maybe if you just highlight, which are some of the most notorious side effects that my client might develop or my viewer might develop, so that they can be on the lookout, so that after receiving the chemotherapy when they go home, they begin out to wonder, hey, this mwili yangu ikuwa hivi.
Yes.
What are some of the side effects, the most common?
Some of the notorious side effects of chemotherapy is fatigue.
Fatigue.
Yes. Remember, the cells have chemotherapy does not choose these are cancer cells; these are normal cells. So most individuals who come up from the chemotherapy, they always feel fatigue because the cell has been dosed with this treatment, and then the mitochondria part of the cell that is involved with the energy has been destroyed. So the patient will kind of feel fatigue for 2 or 3 days after chemotherapy. Another thing that comes after chemotherapy is nausea and vomiting, which is the most common your patient will report, but which is counteracted with treatment, which we call pre-med. Before you get chemotherapy, there are those treatment you get.
Okay.
Yeah, just to kind of counteract this effect that chemotherapy will cause. Another thing you'll start feeling is probably pain in the bones or other part of the body. You also have pain. You also
Hair
have
loss. I saw one person who was scared of hair loss.
hair loss is also common depending on the treatment also you're getting. You also get hair loss. We call alopecia.
Especially I'm talking about ladies. You see ladies with hair.
They are worried of the hair loss.
So you can imagine this lady now with the cancer of the breast diagnosed, then there is that hair.
And I think one of the funny conversation I normally have with my clients before the treatment starts is, will I lose my hair? Yeah, so it's a common.
That's the most common question.
It is a common question, and yes, of course you lose your hair because their treatment combination of breast treatment, one of them is a culprit of causing hair loss.
Okay.
So it's also a side effect, very common side effect. After the first or second cycle, the patient come to you already shaved, had a very good, nice hairstyle, shaved, daktari nilipoteza nywele. So that's true, I agree. It's a common side effect of hair loss. And then most of them, others will come with heartburns. But with all this, your patient will talk to you. It's
But
manageable.
are they manageable?
Yes, they're manageable because the patient will come to you report, Daktari, the last time I left here, I felt heartburn, I vomited after 2 days, I vomited after 1 day, I had pain on my joints, I was fatigued. So with all that, now you counteract depending on what the patient reports to you. And the vomiting has also different types of vomiting because there are those patients who will come just to your facility and just seeing the pharmacy, they start vomiting.
Wow.
And then there are those patients after the treatment immediately vomit, or during the treatment they vomit. And there are those few patients after 24 hours they're still vomiting.
So you've talked about chemotherapy.
Yes.
You mentioned radiotherapy.
Yes.
What is radiotherapy?
Radiotherapy, these are just beams. We use beams to destroy the cancer cells. And radio can both be internal and external. What do you mean by external? We can destroy the cancer cell just from outside. And internal, we can put some radiation implants where the cancer cells are, and then we radiate from there.
Okay.
So these are just beams to try and destroy the cancer cells. Yes.
Okay. So these beams, what exactly are they? Because you talked about external. You direct them towards the cancer, and internal. So internal, you have to do a surgery, then insert them, or how does it go about?
Internal, you don't have probably most of them we don't have to do a surgery. You just have to implant to put it. These are just they're sealed and unsealed seeds that we put where the tumor cells are. And probably, let's give an example of probably you're treating esophagus. You have to have an gastro who will help you to put those seeds where the tumor is, and then now you radiate.
Okay.
So you don't have to have a cut for you to be radiated with internal. Then radiation just to position you where the tumor is. You position the radiation straight to the tumor, and then it's a simple procedure. 2 to 5 minutes, you're done, you're out. Yes.
So just like a machine, an X-ray machine?
Exactly, just
Which
an X-ray
directs
machine. You direct the beams to the tumor,
to the tumor.
and then, yes. Yes.
Now, this radiotherapy,
Yeah.
is it available in the country? Because you're talking some great language. Is it available?
All these modalities I'm talking about, they're available in this country. All these modalities.
Within reach?
Within reach.
Okay.
Yes.
Now, talking to this client or this viewer
Yes.
that's watching us right now, what are some of the side effects they should expect if they have been diagnosed, or maybe their relative has been diagnosed with cancer of the breast, and they are now undergoing through radiotherapy? I believe in most, or I was told that most treatments, they have side effects.
Yes, yes, yes.
Now, also with this radiotherapy, I think also it also has side effects.
It has.
What are some of the side effects that they should be at the lookout? And then they say, I heard from my clinical oncologist, and he said, if I start radiotherapy, I'm going to expect A, B, C, D. So I will not be worried, because I was told this part of side effects, and they're manageable or they're not manageable.
The side effect, the most common side effect again is fatigue.
Fatigue.
Remember, these cells are being dosed again with this beam, with this radiation. So they are destroyed. Like I said, the mitochondria part that is dealing with energy and everything else is destroyed. So the patient after the radiation will always feel very tired. So fatigue is a common side effect. Then there's also something called nausea and vomiting, which is still common with the radiation. There's something called erythema. Erythema is basically the reddening of the place where you're placing the radiation. The skin can start drying up, eventually start moist, and then it becomes a wound or something from there. So those are some of the common side effects depending where you are radiating. Like for the breast, you're radiating on the chest, you can get something like pneumonitis, secondary to the breast. So radiation side effects are commonly depending on where you're radiating. But fatigue, erythema, nausea and vomiting, those are common side effects that will appear anywhere you're radiating
So
using
it
radiation.
depends with where you are.
It depends where the cancer is and where the radiation is done.
Just hold it.
Yes.
There's still a lot that we need to talk here.
Yes.
It looks as if this issue of treatment, there's a lot of content.
True.
That my viewer needs to be enlightened, because I believe some of them maybe they're fearing and they begin to organize for fundraising to fly out of the country. Viewer, I believe you are getting it and you are learning a lot. Kindly hit our social media handles at GBS TV Africa. SMS line is 21144 for comments, for query. We're talking about cancer of the breast. We're talking about the treatment modalities. And my guest here is telling us that all these treatment modalities or forms, they are available right here in this country, within reach. So according to him, he's telling us, no need to worry, no need to panic. And he's telling us even the side effects. I believe you are at the right place, so don't touch that dial.